Welcome to the Healthcare Provider Happy Hour. This is a safe space where we invite healthcare providers to unapologetically be themselves after the working day. My name is Jennifer George, and each week I will connect you with guests and stories that will help transform your stress to success and fulfillment. Are you with me? Grab your drink of choice and let's chat. Hey everyone, welcome to the Healthcare Provider Happy Hour. I'm your host, Jennifer George, and I'm joining you today with Dr. Frank Douglas. Frank is the CEO of Safe Haven Dialogues, which is an organization that empowers individuals to become agents of change against systemic discrimination. Frank also holds his Ph.D. in physical chemistry and his medical degree from Cornell University. In this episode, we chat about a reframed methodology for handling the stress impacts of discrimination in the workplace. The methodology includes equity, inclusion, and individual engagement, EIIE. This was a great conversation. I really think you're going to get a lot of value from this, and it's something that you can also take away with you to your workplace and become more aware and also practice. So grab your drink of choice. You don't want to miss this conversation, and join us. Hi, Frank. Welcome to the show.
Hi, how are you, Jennifer? Thanks for the invitation.
Thank you for being here and accepting. I've been looking to have this conversation with someone on equity, diversity, and inclusion, and your evolution of that as well. And that's one of the reasons why I wanted to chat with you, is because I just appreciate your perspective on stress in the workplace and how it's all connected to inclusiveness and discrimination, and having a conversation around this. So thank you for being here.
Yes, and I appreciate your sensitivity to the issue.
Yeah. Can you first tell us about yourself? Like, what have you not done? When I read your bio, I'm like, there's nothing this person has not done. So I want you to tell us what you want us to know about you, because it's quite amazing to me. So
thank you. Well, I was born in Georgetown, British Guiana, now Guyana, of course. Came to America at age 20 on a Fulbright scholarship as an undergraduate, and did my bachelor's degree in engineering at Lehigh University, then went on to Cornell and did both a PhD in physical chemistry and an MD, and later trained in internal medicine at Hopkins and at the National Institute of Health, where I also did a fellowship. I have been both an academician as well as been in industry. The larger part of my life actually was in the pharmaceutical industry, where, in spite of challenges of discrimination, I actually became the first Black to be on the board of management of a top 5 global pharmaceutical company, where I was responsible for global research, development, and regulatory affairs, and also had the wonderful opportunity of leading scientists who brought to market, who innovated, developed, brought to market more than 25 drugs, including drugs for cancer, hypertension, tuberculosis, osteoporosis, etc. I also spent time in academia at MIT, as well as at the University of Akron, where I actually led and introduced a number of approaches. I led an institute that brought together the 3 hospitals in Akron, the University of Akron and the medical school, to basically take advantage of the tremendous strength in polymer science and engineering at the University of Akron to find solutions for several tissue-related diseases.
Wow. So how did you evolve from basically working in physical medicine, essentially, as well as engineering and bioengineering, perhaps, pharmaceuticals, to now stepping into discrimination, equity, diversity, and inclusion? How did you evolve from there to here where you are today?
Two things, actually. About 5 years ago, as I tell people in my third retirement, uh,
I love it.
I, I started to write my memoirs more as to silence a cousin of mine who for many years would say to me, if people only knew how you grew up in Guyana, they will be astounded to see the leadership that you have on a global scale. And as I was writing my memoir, something struck me. And if I might tell you the story that struck me, because it is related to what I do now.
For sure.
When I completed my PhD, I was hired by Xerox. And for 3 months, I could not get a meaningful project. And one day, a white young man joined the group, and within a week, he was placed on the hottest project we had in research and development at Xerox at the time.
Wow.
So I went to my manager to have another discussion. And I finally said to him, look, Steve, don't think of me as though I'm Frank. Think of me as though I'm Bob. Mm. And I was just stunned to see the recognition, come across his face as he said to me in a very knowing way. He said, Bob has only been here a week and I've already put him on the Ardrey project. Well, I was furious. Mm-hmm. I made it out of his office, went down to the office of the senior vice president to give him yet another example of where I was being discriminated against. Now, about 2 or 3 years later, I thought about that incident and realized I had missed two things. One was that this senior vice president had hired 3 young Black PhDs that summer to join the one Black PhD that Xerox had at the time. So it probably was more important to him that Frank Douglas would do well than it might have been important to Frank Douglas himself. The second thing was that I really was not terribly interested in the senior vice president having tough words with my boss. I wanted a good project. Right. That was the outcome I wanted. So had I reframed and had I said to the senior vice president, Dr. Tribus, could you help my manager find me a good project? I might have retired at Xerox. Wow. Because that was certainly within his sphere of influence. He was 2-3 levels above my boss, and he walked into my boss's office and said, look, find a man a good project. It would have been done.
Wow.
Well, as I was writing my memoirs, and I told, that story and my recognition of the error I made, it suddenly occurred to me that, as a matter of fact, the way I had dealt with problems is that I was reframing. And so I had learned from that. So that was one aspect. The second aspect was looking at the George Floyd incident and looking at the onlookers on the side doing their darndest to try to get Chauvelin to take his knee off of George Floyd's neck, to no avail. But the reality is there was one individual who was suffering and, as a matter of fact, dying that day. And that struck me that during my time, both in industry and academia, whenever there was a discrimination problem, there was always an aggrieved individual. And although, and we've done a lot, with diversity, equity, inclusion type programs, we focus on trying to get the environment to become sensitized, to understand about microaggressions, etc. And we don't do much for the individual.
Yes.
And I asked myself, had George Floyd learned some skills, would the outcome have been different? Would he have handled himself differently? So I brought those two things together and immediately formed a group, which I call Safe Haven Dialogues, to really focus on empowering individuals to understand the issues in their organization, to be clear about the outcome which they would like, and then to take them through a process to enable them to find a better problem to solve. Which problem would not only get them to their desired outcome, but also would be of benefit to their workmates and to the work unit.
So you're really empowering the individual, essentially.
The focus is to empower the individual.
Correct. Okay. You're right, though. Like, I'm just reflecting on all of the work that's being done and all of the organizations that are expressing and making equity, diversity, and inclusion a part of, their values and everything of that nature. But you're right, it's done at a global level. It's not really educated upon, but it's more done from like kind of admin down in a way, right? And maybe programs are being done, workshops, webinars, but I think, like you said, we're not really focusing on the individual themselves as well. And everybody's needs are going to be different. Everybody's barriers are going to be different as well, right? We don't really know what necessarily somebody is going through or what they're experiencing unless we give them an opportunity to share that.
Absolutely.
Am I getting it? Okay.
No, you have it perfectly.
Yeah.
Unless we give them an opportunity to share what they feel, and unless we get an understanding of how the systems or lack thereof in the organization, how they are contributing to how that person feels, unless you do those two things, unless you are able to walk in the shoes of that individual,
right,
not much learning actually occurs.
So true.
There might be empathy, but really not much learning occurs. So that's the one aspect. The second aspect is to have the individual not feel like a victim, but for the individual to understand that there are opportunities here where they, one, become empowered to express what is going on, and the two, where they can, as a matter of fact, have a dialogue, which dialogue talks about, I may be suffering from this, but as a matter of fact, there may be others who are suffering from this. And if we were to address this particular aspect, it would improve productivity, not only for myself, but also for the unit. And the third aspect of it is we look at the issues around inclusion and the issues around equity in the organization as it is affecting that individual. And when you do that, again, as you observe a specific case, you learn more about the problems in the organization with respect to equity and inclusion. So you really get an opportunity to walk within in the shoes of the individual.
Wow. It totally makes sense to me, but it's a very different way from the way I've seen it, right? Like just the perspective that you're sharing. And one thing I did notice when you shared your story is that's one thing I totally connected with, was that you didn't see yourself as a victim. No. As you were sharing the story, and then you mentioning that just validated my understanding of that. So the evolution that Safe Havens Dialogues has done with equity, diversity, and inclusion is now it's equity, inclusion, and individual engagement.
Yes.
Okay, so can you tell me why diversity was taken out of that acronym? Can you elaborate a little bit more on the principle?
Yeah, there are a couple of reasons. One, we are looking at individuals who are there in the situation. So diversity has already been taken care of. They're there.
That's what I figured. Okay. Yeah.
And so the issue is not the diversity part per se, because diversity got us in the door. Unfortunately, the other reason why we do not look at diversity is that diversity, although it was a good way to identify, marginalized individuals, be they women, be they marginalized because of ethnicity, because of gender, because of sexual orientation, age. It's easy to count for that. However, that's a metric. The real issue is that individual being recognized for the contributions that they're making? Is that individual being rewarded? Is that individual being included? Is that individual being treated fairly? Is that individual being given an opportunity to advance in the organization?
Yeah.
And those are the key issues. Now, so we dropped off diversity, simply saying, okay, we're here. Let's deal with what the real issues are.
Mm-hmm.
And there are some simple ways to look at equity and inclusion in an organization. Equity, for example, we say, look at three things. One, are there individuals who are being treated preferentially? Like the rules don't apply to them. It doesn't matter what they do. They may not perform well. They don't get the same. They don't get the same focus, and they're not given a tough evaluation, and they're always preferred. So it's their preference. Secondly, the processes. Are the processes there? For example, the HR processes, are they such that one could rely on those processes to address their situation? And the third is the prospect. Namely, is there a relationship between the individual's performance and their prospect of being recognized and advanced in the organization? So 3 simple ways of looking at equity in an organization. Inclusion, it is sometimes difficult. But if you look at the opposite side, exclusion, people know when they have been excluded. So we look at exclusion and we look at the microaggressions, micro assaults, micro insults, micro invalidations. Again, 3 dimensions. And you ask those simple questions. Is someone, being insulted? Yeah. Is someone's ethnicity, are they being stereotyped, being insulted, micro assault, micro insult? Is someone not being treated consistent with their achievements, with the level where they are? Are they being passed over, etc.? The micro invalidations. Are they being ignored when they're in a meeting and they raise their hand, to offer suggestions based on their expertise, etc.? Micro invalidations. So we have these 3 dimensions in each to look at. The other thing which we actually do, there are 2 things, is that when an individual comes to us, we have them fill out a very simple form, and we ask them to respond in brief sentences or phrases, because what we want to do is to take away the emotion. So we ask, okay, what is the outcome you would like? 1 or 2 sentences. Tell us the environment that you're in. Again, in bullet form sentences. Tell us the situation that you have. And then in a sentence or 2, what do you think the problem is? So that's the one part. The other part, we have a panel whom we call our VIPs, victors in overcoming injustice in their professions. These are individuals who dealt with discrimination, etc. And they're the ones who listen to the case and look for the aspects that affect inclusion, the microaggressions that affect equity, preference, prospects, processes. And once we have that, we actually put together a matrix, what we call our equity, inclusion, culture matrix, because there's a typical 2x2 matrix. And when you do that, you get 4 quadrants, and you can clearly describe the culture in an organization. If you have a culture where equity is high, and by culture we mean what an individual is experiencing.
Right.
Because, you may go to the website and the company may describe,
right,
full, but an individual
yes,
not experiencing that.
Yeah.
So for that individual, okay, is the experience of high equity, high inclusion. That's a psychologically safe environment. That individual is engaged and motivated. So we're coming to your question, why the I?
Right.
If we go diagonally down to the left, where equity is low and inclusion is low, that's a psychologically toxic environment. Individuals are distressed. Many of them leave the organization. Okay? Mm-hmm. So you can define these four cultures. Now, the real, I would say, for me, the real fascinating thing is that for over 30 years, Gallup has been studying literally hundreds of thousands of workers in several countries, several industries, etc., and has identified that for those companies where the individuals were very motivated, where employee engagement was in the top quartile, they had 23% greater productivity, profitability than those that were in the bottom quartile. And he's done this across several industries, countries, etc.
Wow.
So what we have simply said is, in any organization, equity and inclusion, they define the culture, they define the experience the individual is going to have. And the way to measure it is not by the number of different looking people or different histories.
Right. Yeah.
Is by the number of people who are individually engaged.
Wow.
And so we talk about EIIE, namely equity, inclusion, and individual engagement.
I love that. And you described it so beautifully in a way that I could completely understand. So how do people connect with your work? Like, at what level? Is it the individual or the organization who reaches out to you? Could I myself just say, could I reach out to Safe Haven or to you directly and say that, I'd like this to be further looked at or examined so that I feel more included, so that I feel like I'm being treated fairly? Or is it usually organizations that take this project on and take a closer look?
Yeah, both. Actually,
okay.
We've just begun really detailed marketing. We've been describing, etc. We've just begun marketing, and we're marketing to individuals.
Mm-hmm.
We also are marketing it to organizations, because what we're saying to organizations, if indeed, as many organizations say, our employees are our number one asset. Okay, if
Right.
that is true, okay. Well, then, should you not offer something like this, where when an individual says, I've been to HR, I've talked with my manager, etc., I still don't feel like I'm being heard, which is one of the things for us. It's very important. Mm-hmm. I still don't feel I'm being heard. To offer them this program, one. The second is we can train members of the organization to be the VIPs.
Okay, that's what I was going to ask.
Yes.
Because when I just look, even if I'm just browsing, right, like through job postings, things like that, when I just see what's out there, because I'm always just curious about stuff, you see positions posted for, somebody who's, equity, diversity, and inclusiveness. Like, that's a position for one person. Yes. Yes. And is it really how can one person themselves do all of this, right? Yes. I really do think it takes the whole team to be aware, yes, and to take on this issue, and to keep us mindful and aware, and just be aware of how we are interacting with one another and supporting one another and putting all that into actual practice. So,
one of the things that, fortunately for me, is that when I joined industry, I joined as a mid-level manager and rose all the way up to the C-suite. Mm-hmm. So I knew what it was to be a director at that level, and I also knew what it was to be on the board of management. Yeah. And I began to realize, as I reflected on what's happening, is that the leaders are responsible for equity, for setting the rules, the regulations, for telling us, who's on first, who's on second, where are the guardrails. This is how we expect you to, this is how we expect the organization to function. That's the role of the leaders.
Right.
The role of the first line supervisors, first line managers, and work units, they're responsible for inclusion. They're the ones responsible for behaviors which acknowledge each other, behaviors which include, behaviors which say you belong, behaviors which say we value your input, behaviors which recognize your contribution. So inclusion happens at the work unit. Now,
wow, okay.
When those two are not supporting each other and reinforce, that's when we end up having, these unsafe situations, toxic cultures, etc. So when we look at the situation, we try to understand for a particular individual, where are the points of influence? Is it along the equity axis? Is that where they would have an opportunity to find a better problem to solve? Or is it along the inclusion axis? And so we have, in a way, both a visual, but in a systematic way for that individual to get the ahas.
Yes. Right. Yeah. And I'm getting that as I'm chatting with you and you're explaining it to me. It makes so much sense. Like it really does. And no one's ever explained it to me like that, though, in terms of equity and inclusiveness. And, when you explained it the way you did based on leadership and frontline management and supervisors, that makes a lot more sense. And if those are out of alignment or out of integrity, that's where you see the lack of safety there. Just reading behind you, the title of one of your books, Addressing Systemic Discrimination by Reframing the Problem.
Yes.
This is a very fascinating title to me. So can you tell me, and I know you've been talking about this with me right now, but reframing the problem, that kind of sticks out to me. So can you tell me more about that?
Okay.
What you mean by it?
Yes. The example I gave at the beginning of my experience in Xerox is an example of reframing. Namely,
the problem.
The problem. And instead of focusing on, which is what I was focusing on, is that I was not getting a good job because I was Black.
Right.
That's the problem I was focusing on.
And that was the problem, though, right?
It was a problem.
Yeah.
It was a problem.
Okay.
But it was not the better problem to solve to get to the outcome I want. The outcome I wanted was to get on a good project.
Yeah. And this is where you're tying this all together for me now. So this is great.
And had I gotten on a good project, guess what would have happened? I would have felt better about, I would not have felt I was being discriminated against, or I might still recognize I was being discriminated against, but I'm on a good project. So at least that part has been taken care of. Okay.
Yeah.
So being clear about the outcome was important, and finding a better problem to solve to get me to that outcome. That's the reframing part. Okay. I'll give you another. In fact, what the book does, the book outlines the equity inclusion, what we've been discussing. The book outlines the reframing process. So the first part, 2 chapters, one each, to the 2 topics. One, equity inclusion, why that's important, why we moved to EIIE, and the second, the reframing process, and how you come up with a better problem to solve and use that to reframe your problem so that you can have a productive dialogue with your manager and a solution. The rest of the book are interviews which we did with individuals cutting across. So there were 3 physicians actually and 1 nurse. There were individuals working in government offices, individuals in large corporations, etc., small corporations. So there were 18 of these interviews, and we took them through the process. They filled out the intake form, as we call it, very briefly. Once we did the interview with them, we sent the form back to them for them to verify that indeed, what we recorded represented what they said. They made changes, etc. And then our VIPs then went through the case, looking at microaggressions, looking at the equity issues, processes, privilege, prospects, etc. Did the matrix, and then went through the process of trying to find a better problem to solve and then to reframe. I gave you one example, actually, which we use as our teaching case, because that's the one case which is not an individual. It's actually two different individuals, and we brought them together because it allowed us to demonstrate more things. Doing that. But this was a situation, one of these individuals, and as I said, we combined two things. But let's pretend it was one individual who was of Moroccan descent, worked for this small company for about 20 years. During that time, he actually got his master's, in fact, got two masters, one of which was in project management, was treated badly, stereotypical name calling, etc. He complained about it, nothing doing. But he applied for a job and was passed over. An external person was brought in. And then he was asked to help this individual with project management. And we actually found about 3 or 4 such cases in different areas.
Wow.
With that. And his outcome, he had things like he wanted this company to have no tolerance for discrimination, and on and on. And so we discussed that. And one of the things we simply said, what's a point of influence? One of the things we look at. One, on the equity axis, clearly the CEO and the senior managers, JA, we call them JA, had complained, gotten no help from them. Mm-hmm. So not much is going to happen on the equity axis. HR has not been helpful. Nothing will happen on the equity axis. Now, how about on the inclusion axis? Mm-hmm. What is a point of influence? And what we identified is the following. He had suffered a severe micro-invalidation in that he was passed over and then was asked to use the expertise he had to help this external who was brought in. Mm-hmm. Now, one of the things he wanted was to be recognized for his expertise. Well, he was being recognized for his expertise. Wasn't the way he wanted to be.
Right.
He was actually being recognized for his expertise. So that was his point of influence.
Right.
So then we began to think about, well, how could he actually exploit that? Mm-hmm. Well, what if he went to the manager and instead of complaining that he's been passed over, the manager knows he's been passed over. What if he went to the manager and said, since you've asked me to help, let's call him X, mm-hmm. I would like to run some sessions after work for anyone who would like to learn some fundamentals of project management. Because mm-hmm. what we do, everybody needs to know that. Now, it would be very difficult for the manager to say, no, you can't do that when he's asked him to help this person.
Right.
Okay. So he gets opportunity to do that. He is now building his profile. He is now being recognized for his expertise. Mm-hmm. And now this begins to give him a basis to deal with some other things. And in fact, he can then talk with his manager about issues of productivity, how that could improve, and then talk about, wouldn't it be nice if people treated each other with respect?
Yeah. Wow.
And then we can move into that.
Love that. That's a great example. Thank you for sharing that so much. And I think we can all learn from that lesson, just in our own professional lives and personal lives too, really, when you think about it, regardless of where we're at in our careers, whether we're in healthcare or not. But that's amazing. The work you're doing is amazing. We only have a couple minutes left, unfortunately. Yeah. So I hate to cut the conversation short, but I want people to be able to find you, Frank, and reach out to you in Safe Haven if they want to dive further into this for themselves.
Well, they can find me on Safe Haven Dialogues LLC.com, safehavendialogues-LLC.com.
And is your book also a part of that, the
The book,
website?
yes,
Okay.
can be found there. I must warn them, actually, interestingly enough, we will be putting out a second edition of the book shortly after we have, because we've gotten a lot of feedback.
Good.
And the feedback has been too, that the title, you sort of have to get into it.
Yeah, yeah.
And people have come up with shorter titles in which they've said, use this shorter title and then a subtitle that explains reframing to address systemic discrimination. So we're doing that, as well as we're adding to the back cover some endorsements that we've gotten, etc. We just actually submitted it to the publishers today. So I hope that hopefully by September, that will be out. But the present book is available on Amazon and Barnes and Noble.
It's awesome.
And the content is totally unchanged. So whether you buy this or the new version, unfortunately, because it has a new title, it is treated as a new book. And there will be a statement in there that it's just a new version.
Just a new title. Sounds good. Well, thank you so much for being here.